Welcome to the MamasteFit podcast. In this episode, we're going to be talking about how does the top of the pelvis open and what can you do to help your baby engage into your pelvis. Welcome to the MamasteFit podcast. This is Gina, perinatal fitness trainer and birth doula.
And I'm Roxanne, labor and delivery nurse and student midwife.
And this is the MamasteFit podcast, where we empower you on your prenatal fitness, birth, and postpartum return to fitness journey.
Our podcast shares how to move throughout your pregnancy to stay strong and comfortable, because pain is not a requirement of pregnancy. Understand the science of birth and how to approach recovery after birth.
We share our personal experience as mothers navigating this stage in our lives, plus our professional expertise as birth workers and fitness professionals.
Our goal is to help you feel confident as you navigate the perinatal timeframe for an empowering pregnancy, positive birth, and postpartum journey.
We are glad to have you with us on this journey and that you have chosen us to support you.
Welcome to the MamasteFit podcast. In this episode, we're going to be talking about how does the top of the pelvis open and what can you do to help your baby engage or enter into your pelvis. And so this is the first path that your baby is going to take as a part of the labor progress. They might engage during pregnancy. It might take strong uterine contractions for your baby to engage. But let's talk about how does the top of the pelvis even open and how can we create more space there. The first thing that we need to consider is what are common movement tendencies during pregnancy and how might those be helping or hindering the different pelvic levels. And so our pelvis has three distinct levels. We have the inlet, which is the top of the pelvis, the mid-pelvis, which is the bony structure that baby's going to rotate through, and then the pelvic outlet, which is the bottom of the pelvis. And each of these pelvic levels opens with a different type of movement pattern. And so in this episode, we're going to focus primarily on the top of the pelvis, but if you want to learn more about each of the pelvic levels, different biomechanical patterns that open each of those levels to include exercises that you can do during pregnancy to prep to open each of these pelvic levels, and then also labor positions that you can do to open the pelvis during labor, you can join our online childbirth education course where we break that all down in much more depth. In addition to our prenatal fitness programs, we incorporate all these exercises for you. So the top of the pelvis is going to open more with external rotation of the femurs and abduction. What this means is the knees are rotating out as the ankles are coming in. And so we're having this external rotation of the hip with abduction. So the legs are moving apart as they are externally rotating. And so think of movements like really deep squats where the knees are kind of pressing outwards. Think like butterfly pose or anything where the knees are out is primarily going to help to open the top of the pelvis. And what this is doing is creating space side to side in the top of the pelvis. And so this is going to create more space there. And so during pregnancy, one common postural tendency for us is external rotation. So we tend to have wider stance during pregnancy. We tend to be more externally rotated. And so we're already there when it comes to opening the pelvis. We already tend to favor this external rotation. The other type of movement patterns that help to open the top of the pelvis include a posterior pelvic tilt, which means we're tucking the butt underneath so that sacrum is tucking underneath. And what this is doing, it's creating space from front to back in the top of the pelvis by moving the sacral promontory, which is the junction between the lumbar spine and the sacrum, backwards. And so this is going to create more space front to back. But during pregnancy, because we tend to favor that external rotation, we also tend to favor more extension or an anterior pelvic tilt. So we tend to favor arching in our back, which is essentially the opposite of what we want to create more space front to back in the pelvis. And so it's a little bit harder for us to find more of that posterior pelvic tilt. And so this is something to keep in mind as we start to move into different exercises that you could do during pregnancy to help prepare for birth. Another movement pattern that helps to open the top of the pelvis is actually going to be that anterior pelvic tilt. And so this is helping to change the pelvic angle, which can sometimes make it easier for baby to enter into the pelvis. And so a combination of both that anterior and posterior pelvic tilt with like pelvic tilting or hip thrusting type movements can help to create space in the top of the pelvis. So what can you do during pregnancy then to help facilitate this opening of the top of the pelvis? And so we want to focus on movements that emphasize that external rotation or wide leg type movements. So think of movements like squats, for example, like hip thrust. Any sort of movement where the legs are primarily going outwards is going to be really beneficial. And so in our programming, we tend to incorporate a lot of different types of squat movements. So just squats with weights, squats by themselves. You can squat holding onto your partner's hands, but really any sort of squats is really going to be helpful for external rotation. Other movements that we can think about is movements that help with that pelvic tilting. So can we find more of that posterior pelvic tilt and more of that anterior pelvic tilt. And so the posterior pelvic tilt, if you remember, is a little bit harder for us to find during pregnancy. And so we want to focus on movements that make it easier for us to find that posterior pelvic tilt by releasing tension that is pulling us more forward. And so doing movements that help to release the lats can be really beneficial. And also the hip flexors can help make it be easier for you to find that posterior pelvic tilt. In addition, we can think about the muscles that are going to help pull the pelvis into that position, which is going to be your hamstrings and your adductors. So incorporating movements like deadlifts or staggered stance Romanian deadlifts that help to strengthen the hamstrings can help pull you into more of that posterior pelvic tilt to create more space in the top of your pelvis. And so we want to do a combination of all those squats and deadlifts to help create space in the top of the pelvis. And then we can incorporate movements like pelvic tilting, like sitting on a ball and doing pelvic tilt, being on all fours doing pelvic tilt. Trying a lot of variety of movements can be really beneficial because those can help translate to it being more familiar for you when it comes to labor. And so a sample workout that you can do that helps to target opening the top of the pelvis could include a combination of mobility work and strengthening work. So first I can focus on movements that make it easier for me to find these different movement patterns, such as like an adductor rock back, which helps to release the inner thighs, which then makes it easier to find external rotation. After the adductor rock backs, I can do movements that incorporate some hip shifting with pelvic tilt, such as the all fours pelvic tilt hip shift. I'm really bad at naming exercises, so all of them are super long, even within our programming, and just kind of list out the things that you're doing. But in this exercise, we're going to be focusing on releasing tension in the pelvic floor and making it easier for you to find that posterior pelvic tilt. In addition, we can incorporate exercises that are focusing on releasing in the lats, like the forward-leaning lat release and the hip flexor release, which is going to help and make it easier for you to find that posterior pelvic tilt. All of those movements are included in the MamasteFit birth prep circuit. So if you want a series of movements that you can do to help prepare your body for birth, to prepare the pelvis to open, you can grab that freebie so that you already have just like a list of exercises that you can do. When it comes to strengthening exercises, we want to focus on finding external rotation and strengthening the hamstrings as well. So you can do a workout that's like 3x10 squats with forward step ups. So these are both focusing on that external rotation, combined with 3x10 deadlifts with like a poor man's leg curl or something that's emphasizing more of that hamstring strengthening.
One thing that we want to really consider when we're working out during pregnancy, though, is that we are getting enough protein. Our protein requirement just in general during pregnancy is like way higher than outside of pregnancy. And that's just being pregnant alone. It's between like 75 to 100 grams of protein is necessary. That's not including the protein that we'll need if we are working out. And it's really hard to eat that much protein just like out of food. So we really like using Needed's collagen protein to augment the amount of protein that we need in our daily diets. So we have both taken Needed's collagen protein during our pregnancies, postpartums. It is our favorite collagen protein that we have used. It dissolves so easily into every beverage or even like chia seed pudding. I love like mixing it into like my chia seed pudding or my overnight oats. And it has like no added flavor to any of the things that I've added to it. If anything, it makes it a little creamier, which is kind of nice, especially in my morning cup of coffee. So if you want to try out Needed's collagen, which is our personal favorite, we both used it. You can use code MamastePod for 20% off your first order, or you can do a subscription and you get 20% off the first 3 months of your subscription with MamastePod.
And so during pregnancy, we do want to be focusing on workouts that not only keep us strong throughout our pregnancy, keep us comfortable and pregnant, but we also want to be thinking about how are our workouts preparing us for birth. And with the MamasteFit fitness programming, we're focusing on different ways that we can open the pelvis and ensuring all of those movement patterns are accessible to you. And so when we're trying to open the top of the pelvis, we're thinking about that external rotation with abduction. So can we bring the knees out and the ankles in addition to pelvic tilting? So finding that posterior pelvic tilt or tucking the butt underneath and rounding in the back, and then also that anterior pelvic tilt. During pregnancy, the external rotation with that anterior pelvic tilt tends to be more of a common tendency. So those are probably easier for you to find. And so during pregnancy, we can focus more on ensuring that we can find that posterior position by incorporating movements that help release the tension that are pulling us more forward, so releasing the lats and hip flexors, and then incorporating exercise that help pull us into more of that posterior pelvic tilted position, such as strengthening your hamstrings or your adductors. And so incorporating movements in your workout programming that release the lats, the hip flexors, and strengthen the hamstrings can be really beneficial for your birth preparation. Those are all movements that we incorporate within the MamasteFit prenatal fitness programming and are incorporated within the MamasteFit birth prep circuit, which is free for you. The circuit is free for you, not the programming. The programming costs money, but you can use code STORY10 and get 10% off. So let's talk about what we can do to help our baby engage or enter into our pelvis. So when it comes to helping your baby engage into the pelvis, it's first important to say that you don't have to have your baby engage before labor begins. We get this a lot where folks are like, what can I do? My baby's still high. Labor is never going to start. Your baby can still be floating above your pelvis and labor can begin. Like, it doesn't determine labor onset. I Googled it. I researched it because my baby was super low and engaged. And I was like, surely this means she's going to come early. She did not. She came at 41 plus 3, and she was like deep in my pelvis. So just because your baby is not engaged does not mean labor is never going to begin. That is, your baby's station or how high or low they are within your pelvis does not determine labor onset. And so instead of during pregnancy of focusing on trying to get your baby into this perfect position or to force them to engage, we rather want to ensure that, one, their path to rotate is clear. So we're releasing tension and restrictions within the uterus, within the surrounding musculature, within making sure that the pelvis moves really well. And then we want to make sure that we have the capability to open each pelvic level. So we're not focusing on trying to force our baby to engage, but rather ensure that their path to rotate and engage is clear. And so when labor does begin, if your baby has not quite yet engaged into your pelvis, now we have strong uterine contractions to help them rotate to then fit and enter into the pelvis. And there's lots of different labor positions that we can do to help create more space at the top of the pelvis and to help your baby engage into the pelvis. So Roxanne, can you share some of those labor positions that you have found to be really beneficial as a labor nurse with your patients?
Yes, I can. First, I'm going to discuss, so Gina's talking a lot about the different parts of the pelvis, the inlet, the mid-pelvis, and the outlet. This is not like the next question that we usually will get about like, oh, the inlet, the mid-pelvis, and the outlet is how do you know your baby is in any of those locations or trying to engage in any of those locations? One, it's going to be your intuitive movement patterns. So like how to know if your baby is engaged or not engaged is like how you are intuitively moving at the beginning of labor. Are you kind of favoring those externally rotated type movements and like forward and back type movements, then that's like kind of a key to know like, hey, my baby is trying to engage. Let me think about different movements that I can do to help my baby engage. Or your provider can do a cervical exam, and based off of your baby's station, then this correlates to different parts of your pelvis. So Gina talked about station for a second, but what station is, it is a number, either a minus number or a positive number or a 0. So 0 is what's called the ischial spines, with these like bony protrusions that are within your pelvis that your provider or your nurse can feel when they do a vaginal exam. That is 0 station. Anything above that is a minus number. Anything below that is a positive number. When baby is not yet engaged into the pelvis, this is a -2 or above. Usually they're not going to give you anything above like a -3. That just means baby is like floating. Sometimes their station will even be like floating. So that just means baby's not yet engaged. But if your provider tells you like, hey, your station is -2, and sometimes they won't tell you this, sometimes you have to ask because they'll just tell you your dilation, but they can tell you your station, and this can also give you an idea of what movements you should be using. And again, so -2 and above is inlet, so your baby is needing to engage. And it is subjective. So one person's -2 could be another person's -1. So if you're like between -1 or -2, doing inlet movements here can be beneficial. Things that like if someone does not have an epidural is that you can squat when you're in the hospital. And there is like you can squat in the bed with like a squat bar and kind of sit there for a little bit longer. Like you can do a lot of things like on the birth ball in the hospital. Every hospital usually will have a birth ball that you can utilize. And there is also stools that you can utilize if you wanted to like sit in a deep squat and you didn't really want to sit on the floor at the hospital. You can sit on like a stool too if you wanted to get out of the bed. Most of their bathrooms will have some sort of like handle either in the shower or next to the toilet that you can kind of hang on to do like more supportive squats, or again, you can use your partners. Most of the time, though, when I am offering positions and baby is not engaged, it's usually when someone has an epidural. So most of the time, people are going to intuitively move into positions that they are going to want to be in comfortably. And I'm not going to like be like, hey, I know you're really comfortable in that squat, but how about let's try something else? Because if they're unmedicated, most likely they're just going to want to listen to their body. But if you have an epidural, this is when my kind of positions kind of more come into play. So usually when someone has an epidural and their baby's not yet engaged, the first position that I'll normally do is flying cowgirl. So this is when someone's on their side, and I usually will still ask, because your intuition is still there in labor, even if you have an epidural, which side someone wants to start with, because usually they'll have like either a feeling of which side they should lay on first. But this is when we take this peanut ball, which is like a magic labor ball that was created by a labor nurse who's now a millionaire, I'm sure.
Probably not. But do not buy a peanut ball. Hospitals have them. I have found no other use for them other than labor.
You can use pillows.
So do not buy a peanut ball. They're not very expensive, but they're just not really worth the investment.
You wouldn't use them ever again. I mean, you can donate them to like
the
a birth
hospital
center
will
or
definitely
hospital.
will definitely have some.
But do not use them at home. This is more like once you're in labor that this would be beneficial. You can use pillows, though, if you're at home, that you can put between your legs. So you put the peanut ball or a bunch of pillows between your knees, and this is creating that external rotation. And then you can stay like that. Like some people would just stay like that. But to get that posterior tilt of your pelvis, we bring the hips into full extension. So like you bring your hips all the way forward, and then your feet are behind you, like a little mermaid, if you think about it. So this is helping your baby engage into the pelvis by giving that external rotation as well as that posterior tuck, because that's usually the harder position, especially with an epidural, that you're not going to be able to find as easily. With this, you might be able to move yourself into that like full extension yourself, depending on the density of your epidural. But most of the time, you're not going to actually get into that full extension. Most of us, when we think we're in full extension, we're not truly in full extension just because it's a little bit tighter in our hip flexors. So this is when I would then reach underneath somebody and just pull them actually into full extension. And then you just stay there for 15 to 30 minutes or until you feel a change, and then switch to the other side. And again, do that for 15 to 30 minutes. So that's like the first one that I would do.
And so you might be a little confused of why full hip extension is creating a posterior pelvic tilt, because you may be thinking, I thought rounding in my back created the posterior pelvic tilt. They both do, which is really confusing. But full hip extension actually tucks the sacrum underneath, and it creates the opening in the top of the pelvis in addition to rounding in your back. So there's two different movement patterns that you can do that look really different from one another, that both cause the same type of opening within the pelvis. But that position is sometimes really uncomfortable because it's like it doesn't feel great to be in full hip extension with this ball between your knees and the ankles coming together. And so you can also just maintain flexion in your hip with the knees wide, because hip movement is probably much more influential in opening the pelvic space as opposed to how much your sacrum is moving.
But if you do have an epidural, usually people don't feel it doesn't feel uncomfortable because you're numb. If anything, I've actually had people say like, oh, this is actually really nice, because again, your hip flexors are so tight sometimes during pregnancy that like that stretch feels really nice.
And so someone can also grab your top leg and kind of pull it back to stretch the hip flexors as well, which can be super beneficial. So doing like a psoas release on your side with someone kind of directing your leg around. If you have no idea what I'm talking about, just Google like side-lying psoas release and you'll have a better visual in your head. But essentially, I would grab the thigh, I would bring the hip into full extension, then I would kind of pull back as I kind of massage the hip flexor or the front side of the thigh and pelvis to help somebody come into a little bit more of that posterior pelvic tilt. So that can be a good option. Something else that I like to do if somebody's baby is still trying to engage during labor is you can also be in all fours and you can move even with an epidural. And so I will put a little disclaimer. If your epidural is so strong that somebody else needs to pick you up and put you into a tabletop position or put you into a squat position, probably not a safe position for you. But if you can just kind of hop around and move all over your bed, which some folks really can with an epidural, I would say getting into a tabletop or more upright position is totally feasible. You can also just move into like a throne position where they use the bed to kind of tilt up and you lean against it if you don't have as much mimic capability, so you're a little bit more upright, and then you can have your legs kind of butterfly out. You can come into all fours on the back of the bed, so you put your chest on the top of the bed, and then you can kind of rock back and forth. I'll throw the birth ball in the bed and people can rock back and forth for the pelvic tilting with the knees wide. And so you are not limited by movement just because you have an epidural, but you may be limited depending on how strong the epidural is. And so playing around with the amount of medication that you're receiving can kind of change the level of the epidural. And this could be something that you and your nurse kind of figure out together, or you and the anesthesia figures out, depending on how your hospital does it. But you can kind of play around to figure out like what the best level for you is. Because again, we all kind of respond differently to different types of pain medication.
And some people,
well.
It's just your anatomy as well. So some people are just more prone to either a less dense epidural and a more dense epidural, just based off of where it's located and the amount of nerve endings. So like the decreasing and increasing medication may not work for you in your personal case, just based off your personal anatomy and like where they got the epidural placed. So like they might decrease the medication and all of a sudden you still feel like every contraction, and know that unfortunately, like maybe you'll just have a denser epidural, or like you might just be able to move a lot with your epidurals. So it's epidurals, they're a blind procedure. We can do a whole episode on them, but
so when we're trying to figure out like trying to help your baby engage, it's important to note that baby's engagement does not correlate to a phase of labor either. Your baby can still be super high and you're in active labor. You could be pushing with your baby really high. And so don't think like inlet opening, help baby engage early labor, mid pelvis, help baby rotate active labor. Like that is not necessarily true. So your baby can be floating and be super high and you're pushing, and then vice versa. Like your baby can be super low and you're like
1 centimeter.
Like 1 centimeter. So it is not correlated to a specific phase of labor. So when it comes to helping your baby engage into the pelvis, we want to think about, can we create more space within the pelvic inlet? And that's going to be with that external rotation or wide knees with the ankles coming in. So we're thinking spreading the knees apart while also rotating in the hips so that the knees go out as the ankles come in. And that's going to create more space side to side in the top of the pelvis. And then we want to create more space front to back with that posterior pelvic tilt by tucking the butt underneath, and an anterior pelvic tilt, which is going to change the pelvic angle. So this kind of pelvic tilting type motion is going to be really beneficial to creating more space front to back in the top of the pelvis. During pregnancy, we tend to favor external rotation and extension, and so those are going to be easier movements for you to find during labor. However, we have more issues finding more of that posterior pelvic tilt or tucking the butt underneath. So if you are experiencing any stalls or like issues with your baby engaging into the pelvis, we may want to think about what can we do to create more of that posterior pelvic tilt. It might be doing like that psoas release, somebody massaging your back to release your lats to make it easier for you to find that tucked position. But ideally, we're focusing on this during pregnancy. We're not waiting till labor to figure out that we have movement restrictions. We're doing this during pregnancy. And so you can grab the MamasteFit birth prep circuit, which is a free circuit that you can do. We include descriptions, videos, and pictures so that you know what movements to do to help create more space within your pelvis. It targets the posterior pelvic tilt. It also targets internal rotation, which is important to open the bottom half of the pelvis. And so you can grab that guide for free. If you want more of like a daily workout guide, you can join our prenatal fitness programs where we kind of guide you through each day and what to do to keep yourself strong, comfortable, and also help prepare you for birth. So it's more than just a workout program that's pregnancy safe. We're including exercises that are actually beneficial for you during your pregnancy in your preparation for birth. And if you want to learn more about pelvic mechanics and movements that you can do to create more space in your pelvis, labor positions that you can do, and then also what to do if you do experience a stall or if your baby's having a hard time engaging into your pelvis, join our online childbirth education courses where we break that down all for you. We talk about pelvic mechanics, labor positions, and even addressing labor stalls and so much more so that you feel confident going into your birth.
If you enjoy this episode, please like, subscribe to our channel so you can be notified when we release new episodes. Please tell your neighbors and anyone that you know that is pregnant or postpartum. So
any
they can
pregnant person that you see, tell them about MamasteFit.
Anybody. We release new episodes every Wednesday and birth stories every Friday. If you want to share your birth story on our podcast, fill out the form below and we'll contact you to get you on the podcast. This podcast is sponsored by Needed, a nutrition company that's focused on the perinatal timeframe that both Gina and I took during our pregnancies, postpartums, and our husbands even take their products. We love Needed, and you can check them out with our code MamastePod to get 20% off any of their products with your first order or the first 3 months of your subscription.